Okay, we'll go ahead and get started. Hi, everybody. I'm Allison Foster, Executive Secretary for Delta Mega, and happy to be hosting today's presentation. I hope you know that Delta Mega is our 100th year, so we've got a lot to celebrate. There's currently over 130 chapters, all at CFA accredited schools and programs. And combined, we have about 30,000 members of Delta Mega. So we've been hosting the Innovative Curricula Award since 2001. And since then, it's been really amazing to see the number and the just terrific quality of the submissions we get every year. The award is designed to stimulate the development of curricula that prepares students in meeting challenges of contemporary public health. And so what we do every year is we do have the award ceremony, and then we invite many of the presentations to present on their curricula. So I want to remind you that we record the sessions, the presentations. So if you go to our website, you can find recordings of the last several years' presentations. And our series this year, we had a presentation on January 18th, which is recorded. We'll have the presentation today, we'll get to in just a moment. We will have another on the 23rd of January, and we'll also have one on May 9th. All right. But for today, so we have three presentations for you. So you're going to hear from faculty from University at Buffalo, University of Louisville and the Health Department, and University of North Carolina School of Public Health. So I'm going to have each of the presenters go ahead and introduce themselves just to keep the flow going. So you'll get to hear a little bit about their background. I hope that you all have questions during the presentations, and if so, you can either put them in the Q&A or in the chat, and we will have a little time at the end. This webinar typically runs about 30 minutes. We might go a little bit over just because we've got three presentations today, but it'll probably be about 35 minutes or so. All right, so I'm first going to turn this over to Dr. Nicholas Felicione from SUNY Buffalo, and I'm going to stop sharing and go right ahead.
All right. Hi, everyone. I'm excited to be here. Thanks for coming to this talk. I'm Nick Felicione. I'm an assistant professor in the Department of Community Health and Health Behavior at the University of Buffalo. And I'm here to talk today about a course I developed about harm reduction from a public health perspective. So just for some basic background, what is harm reduction? Harm reduction is a set of evidence-based and pragmatic strategies, interventions, and policies that aim to reduce the negative consequences of potentially risky or harmful behaviors. This is most typically applied to things like substance use and sexual behavior, but we also talked about a variety of examples and how this can be used in other behaviors. And some key components of harm reduction is meeting people where they are, understanding what someone wants and how they want to improve their quality of life and helping them achieve that. And it can include individual behavior change, community interventions, and span up to policies and system levels approaches. So just for an easy intro, even though we don't typically think of it, harm reduction is used in our everyday life. We engage in plenty of risky behaviors like driving. But rather than saying don't drive, we find ways to make it safer, like seat belts and car seats. Same thing, we went through COVID recently. It was not necessarily possible to stop all interactions, but we did things like masking and social distancing as a way to reduce your risk of exposure. And another one is like the use of condoms. We don't typically promote abstinence only in terms of sexual education, but ways of reducing STIs and unwanted pregnancies. So moving towards substance use, this can really be applied to a variety of substances. One I think about is tobacco. Cigarettes are the leading preventable cause of morbidity and mortality. but maybe there's safer ways for people to use nicotine through things like e-cigarettes and nicotine pouches and other non-combustible products. And then applying to opioids, there's a variety of strategies. We have things like syringe service providers to get people clean needles so they stop the spread of disease. There's things like never use alone hotlines. So if someone can be on the phone with someone who's using a substance, and if they become unresponsive, they can call for help. And there's even in Canada, a couple other countries, and some are popping up in the US, places like supervised consumption sites or overdose prevention centers where you can use your substances basically while supervised in case anything goes wrong. So the main rationale for this course is that harm reduction aims to reduce the negative consequences of potentially harmful or risky behaviors. These harms may be health, social, economic, legal, or others. And importantly, harm reduction saves lives and promotes and supports positive change, which is why it's aligned with public health. We're still recovering from the effects of the war on drugs. And even though we have a lot of really good abstinence-based treatments, people are still experiencing morbidity and mortality related to substance use and other risky behaviors. So these treatments aren't enough. We shouldn't leave behind those who are unable or unwilling to stop. We should find ways for them to live a healthier life. The harm reduction movement is also growing globally and in the US. It was typically championed from the bottom up as like a grassroots movement, but now we're witnessing a shift for more formalization of harm reduction programs in policy and funding. So SAMHSA awarded grants for its first ever harm reduction grant program in 2022. And in 2021 in New York City, On Point opened, which is the nation's first legal overdose prevention center. So the goals and principles of harm reduction are strongly aligned with public health. These include things like evidence-based, compassionate, non-judgmental, pragmatic, and just promoting health. So now is really a critical time to educate and develop skills for future public health professionals about this relevant topic. The overall objectives for this course were to apply the principles of harm reduction to various public health issues, construct structural approaches to reduce harm at various levels, including local, state, national, and global levels, demonstrate ethical principles associated with harm reduction, appraise barriers of implementing strategies in various populations, and discuss the connection between social justice and harm reduction practice. These were all covered through weekly lectures, discussions, readings, and activities, and they were assessed through things like reflection papers, article discussions, group assignments, and paper and presentations. And notably, we had a big focus on community-based public health practices in this course. So just for an overview of the topics we covered, in the beginning, we talked about the history and principles of harm reduction and the war on drugs. We covered a variety of substances like tobacco, alcohol, opioids, and cannabis. A couple of weeks in there were focused on community-centered harm reduction and conversing with community experts. And then we covered some more novel topics in this area, like when we talked about other addictions, behaviors, and risks. We talked about things like gambling, technology and social media, self-harm, eating disorders, abortion, maybe these areas where harm reduction isn't as formalized, but can still be relevant. For special populations and intersecting issues, we talked about things like pregnancy, adolescence, rurality, incarceration and incarcerated individuals, and housing and employment. And then to wrap up, we talked more about global approaches to harm reduction, navigating public policy and advocacy, and then had class presentations. And for these topics, we really looked at them across the levels of the socio-ecological model. There was a lot of focus on community, but we also talked about individual, interpersonal, and societal levels. So like I mentioned, engaging with the community was an important aspect of this course. We had presentations from several community partners. First, we had Cheryl Moore, who is the director of the Erie County Opioid Task Force, who discussed the role of the county health department in fighting the opioid crisis and reducing harms of opioid use, including providing a naloxone training. Emma Fabian is the Associate Vice President for Harm Reduction at Evergreen Health, which is a local organization. And she's really working in the field and discussed her hands-on experience providing harm reduction services in the community. Anya Wood is a field educator at Evergreen Health who taught about harm reduction and sexual health based on her direct experience promoting harm reduction among sex workers. And then we had a political director and leaders with lived experience from Vocal NY, which is an advocacy group. And they discuss strategies to advocate for drug policy reform and how they utilize their story and experiences to promote change. All of these were commonly cited in evaluations as highly effective elements of the course that promoted an inclusive learning environment. And just a note for anyone, I did not have connections with any of these people. I just kind of emailed them and reached out and talked about what I was doing. And they were all really excited to get on board and really happy to help. So if you don't have those connections, don't let them stop you from reaching out, because that's how you form them. We did some things to build community skills. So the National Harm Reduction Coalition offers a training called It's Our Backyard 2, Building Community-Centered Support for Harm Reduction. And in this training, it worked on identifying community values, putting those values into practice, and building support. And then the whole class culminated into a final project proposal for a new harm reduction service in our community. So they had to provide an objective statement, then give the background, identifying why it's a problem specifically in our community, what are the current efforts to address it and why they're insufficient, providing a solution. So what's their proposed policy or program? What's the evidence that it will be successful? And how will it address the problem and improve upon the alternatives? Identify challenges, what bumps in the road may come up? Are there potential unintended consequences? Are there stakeholders or others who may be negatively affected? And importantly, how can we overcome these? And then concisely wrapping up to convince the stakeholders to join you. And this was done through an outline, a full proposal, and then a presentation at the end of class. Some other skills we worked on developing, students received a hand-on Narcan training. They also did some in-class group assignments, which were purposely chosen that way to help develop collaboration, communication, decision-making skills. So one, they had to develop a budget proposal for a new harm reduction service provider, and each group was given different budgets so we could really compare and contrast how much money they had and what they were able to do in terms of their personnel, space, supplies, and justifying that budget. And similarly did a project to identify stakeholders for a harm reduction program, like 3 to 5 key primary and secondary stakeholders and their importance and influence. We also worked on some public speaking skills. So everyone led an article discussion, and those article discussions also facilitated skills like critical reading and analysis of scholarly articles and learning how science can translate into practice. And they all presented their harm reduction proposal at the end. And I just want to note this class touched on a couple of CEEF MPH foundational competencies. So in public health and healthcare systems, we talked about the means by which structural bias, social inequities, and racism undermines health and creates a challenge for achieving health equity. In terms of planning and management, we talked about assessing population needs, assets, and capacities that affect community health and designing a population-based policy, program, project, or intervention. In terms of policy, we talked about proposing strategies to identify stakeholders and talked a bit about policymaking process. And in communication, worked on communicating audience appropriate public health content in writing and in oral presentation. So just to wrap up, I want to acknowledge some resources. Like I mentioned, local resources like Evergreen Health, our county health department, and New York State Office of Addiction Services. There are some national things like National Institute of Drug Abuse and SAMHSA. And there's a bunch of independent organizations working in this field that are really great, like Harm Reduction International, the Harm Reduction Coalition, and the Drug Policy Alliance. So that wraps it up. I'm happy to take any questions at the end. And other than that, you're welcome to email me with any questions. Thanks.
All right, thank you, Nick. That was terrific. All right, so yes, so please add any questions to the Q&A and we will get those at the end. So now I'm going to turn this over to my colleagues, Madison Yerges and Tammi Thomas. Thank you very much.
Good afternoon, you all. Maddie and I are going to talk about an outbreak simulation for dual credit high school students. And to go over a little bit of background, one of the things that the University of Louisville School of Public Health offers is a 3-credit or a 3-class sequence of dual credit classes. And in spring 23, we wanted to do a co-curricular activity with the high school students to expose them to what the role of an epidemiologist is. And what we did was Maddie is a health educator with the Kentucky Department for Public Health, and she focuses on educating high school students. So we worked on developing a disease outbreak simulation. And the students that participated were in 9th through 12th grade. We also collaborated with the U of L School of Medicine, as well as the local health department.
So to kick off our activity, we wanted to introduce the day in a fun, kind of unique way to really capture the students' attention. So to do that, we started the activity with a breaking news broadcast. And the lady who did the broadcast for us was a former news anchor, so she was very convincing and really sold that there's a breaking news outbreak in your community. So this broadcast really set the stage for this scenario. It detailed information about the counties impacted, the number of patients, and then the signs and symptoms of the outbreak. And then we also wanted to provide the students with some handouts to guide them throughout the day. They're high school students, they don't really have that foundational public health knowledge, so any material that we could give them to help guide them is something we wanted to equip them with. So we created the clinician's handbook, and it provided information about 3 different possible disease outbreaks. Those 3 potential causes were strep throat, Rocky Mountain spotted fever, or viral meningitis, and Rocky Mountain spotted fever ended up being the cause of our outbreak. We went with a vector-borne outbreak just because of its apolitical nature. Everybody hates ticks. At the end of the day, I think we all felt a little itchy. But it provided an opportunity to introduce students to kind of an unknown element of public health that they haven't been exposed to yet. And that is the clinician handbook. So for our next phase is when we partnered with the standardized patient program at the University of Louisville. Students rotated amongst 4 different standardized patients to gain patient interviewing experience and assist them in determining the cause of the outbreak. If you're not familiar with standardized patients, they are really amazing and trained professionals who typically help medical students as they're going throughout their education, but we were able to utilize the standardized patient skills and bring it to a high school level. And standardized patients were given information about their character prior to the event. And then students were also given time to brainstorm some questions that they wanted to ask the standardized patients. We also medical mouvage 2 out of the 4 SPs to have a Rocky Mountain spotted fever rash, which is pretty indicative that Rocky Mountain spotted fever is present, and that just helped guide the students on the path towards arriving at the outbreak. And then students also reconvened in their small groups to discuss their findings and really brainstorm thoughts. So this is just an example of what the patient cases were. We went with kind of a diverse background. And then this is what the Rocky Mountain spotted fever rash tends to look like. So the patients were medical mouvage to show that. The third phase in our activity was after determining the cause of the outbreak, students learned about environmental health. So we partnered with the environmental health services team at Louisville Metro Public Health and Wellness. And 2 of their registered environmental health specialists came out and talked to the students about environmental health, what careers in environmental public health could look like, as well as vector-borne diseases. And then the students also got to observe the environmental health specialists perform a tick drag. And if you are not familiar with what a tick drag is, this is an example of one. You really just drag a cloth over a forested grassy area and the ticks stick to the fabric. And then they also learned about the different types of ticks we have in Kentucky, their life cycle, really vector-borne information. And so to conclude the day, students reviewed the 10 steps of an outbreak investigation and developed a public health plan. They learned about case definitions, they oriented data by person, place, and time, recommended immediate control measures, and then brainstormed communication ideas on how they would communicate this outbreak to the public, as well as how they could prevent future cases from arising.
And so at the conclusion of the event, students completed an evaluation with a QR code. And if you take a look at the results, the idea was that if the overall activity was going to help them understand the role of public health and epidemiology and how it plays itself out during an outbreak. And you can see that everybody was strongly in agreement. The majority of people were strongly in agreement with, yes, this activity did serve its purpose in that manner. They believe that interviewing the standardized patients contributed to their learning. And we did give them some questions to ask, but then we wanted them to come up with some questions on their own. And we really tried to make it as step by step as possible for them, so they would understand the steps of someone that's in an outbreak situation. And if they're an epidemiologist or if they're an environmentalist, what role are they playing? And then also how enjoyable the outbreak investigation was. Very enjoyable and enjoyable. Now, this was on a Saturday, and we had a large group of students show up. We did feed them breakfast and pizza for lunch. So it was a great opportunity for them to have something on a Saturday to do that tied it back into their dual credit coursework. As far as next steps go, we've offered this now to the hosts of students who come into Louisville for a state conference every year. We're hopefully going to continue to do that, and we hope to offer these types of activities with the dual credit students each semester. And every iteration we get better and better at it, as far as what tools we feel like the students need, what types of presentations the students may need to understand the particular elements involved in an outbreak investigation. We just did this on March 15th with the HOSA State Conference. We weren't able to get medical moulage, but that definitely, I feel like, was a huge hit, because the moulage team was involved with the School of Medicine, really walk through how the patient should act with the students, how they should respond to questions. So this, all in all, this took about a half day. So we got them at 9 o'clock. We wrapped up about 1:15, 1:30. So to go into this kind of detail, you do need to plan for about a half day exercise. We have done one that was a little bit less time-wise, and it wasn't as detailed. And I don't think, well, I think it was good. I don't think the students got as much out of it as they did with this. And they really enjoyed the tick drag, though at that point they decided they weren't going in the grass because of the ticks. But anyway, if you all have any questions, feel free to reach out to us. This has been a great opportunity, and we are very hopeful we're going to continue to work with the local high schools.
All right, that was terrific. Thank you so much. Okay, so our final presentation for this afternoon, Liz Chen's going to talk to you about design thinking for the public good.
Yeah. Hi, everyone. I'm Liz. I have two roles here at UNC Chapel Hill. So the first is as an associate professor in our Department of Health Behavior. And the second is as design thinking lead at Innovate Carolina, which is UNC's Office for Innovation, Entrepreneurship, and Economic Development. So for the course that I co-created back in 2020, 2021, I got to merge both of my roles at UNC. So design thinking for the public good is a 3-credit course. It's the required course for a graduate certificate that I started back in 2020. And so the certificate in innovation for the public good is the most popular certificate here at UNC Chapel Hill for grad students. It's co-sponsored by Gillings, the UNC School of Education, and our Department of Public Policy. We have offered the course multiple times since spring 2021. The fall section is always offered via Zoom and the spring in person. And that choice is because for the fall course, we try to make sure that we are available for students across the university. And a lot of our nursing and medical students have class Monday through Friday, 9 to 5 on campus. And so offering them 5:30 to 8:30 as an evening time via Zoom makes that easier for them. And the course is very popular. I think that it draws a lot of students who are looking for applied hands-on experiences and a new framework that many of them haven't had exposure to priorly. So the course does enroll 40 to 50 grad students, mostly in public health, public policy, social work, and education. I copied and pasted the course description from the syllabus and then highlighted the key parts. So we are looking to train an interdisciplinary group of grad students to apply the mindsets, methods, and process associated with design thinking. And we do that in a way where students have a service learning component throughout. So they do collaborate effectively with community members and a partner organization and work towards designing solutions for a particular challenge. Here, I just highlighted some of the competencies that we do cover in the class. So it's not a required MPH course. And so we don't have concentration specific competencies that we map onto, but we do have a lot of methods and opportunities for students to assess population needs, to apply awareness of cultural values and practice, especially to the design of public health policies and programs. They do propose strategies to identify and engage partners in the community. They communicate in a variety of different ways, audience appropriate content. And we do integrate perspectives from other sectors, especially since we have community partners and students outside of public health. So for those of you who don't know what design thinking is, it is a creative problem-solving approach that has a lot of history in engineering as well as business. And what I love about it in terms of a public health lens is that it starts deeply with an inspiration phase that requires us to go directly to people and really think about, is the question or challenge that we're setting out to solve the one that community members actually care about? So for students outside of public health who don't have a lot of ethnographic or qualitative data collection expertise or practice, this is very eye-opening for them. And design thinking then goes into a lot of activities that are set to create lots of different ideas and concepts, and then problem solving and whittling down those concepts and testing it and testing multiple concepts in iteration with end users or community members. I think all too often in public health, because of the way systems are set up, we're forced to converge very early on a single right answer. And we miss out on the creative opportunity to test things in bits and pieces, especially with community. So this course really drives the point home that we should test early and often alongside community, followed by a typical implementation phase. So in terms of course assignments, we've found a lot of success in breaking it up between 50% individual assignment points, 50% team points. And in addition, when we are giving individual assignments, we care more about the reflections and the lessons learned, more so than what students actually did or how they planned community engagements. And so we've started the assignments that are part of the semester-long project here. So students are working with community partners and they have to come up with an inspiration plan, then execute it, an ideation plan, then execute it. And they end by proposing an experiment for their community partner to run to test a promising idea that they've come up with. And there are two ways for community partners to engage in our course. We put out a call usually a month or two before each course starts. And there's the one-time design sprint where community org might come with a specific challenge and bring members of their community to our Zoom class or in-person class, and students engage with those community partners and then offer ideas or potential solutions. So that's a one-time commitment. And then there's the semester-long project. So working with us across the whole semester, 16 weeks. And it's still the same where the community org brings a challenge, but instead of just a one-time hour-long engagement with their students, there are 3 intentional community engagement days where members of the community join our students and they iteratively chat, go through activities, and test different ideas and solutions. So in terms of some of our sample community partners in the past, I just highlighted some of the ones that had more of a public health bend than others. And then we also put their design challenge here and then the semester that they worked with us. So some of these range from hospitals, so how might we make it easy and consistent for providers to connect elderly patients discharged from the ED with interventions that reduce falls, to ones that are maybe more meta. So how do we better foster the sharing of accreditation ideas and experiences across health departments from North Carolina Institute of Public Health? So we have a range of partners, and oftentimes we have partners in public health, social work, and education. And then just wanted to end by highlighting that systems thinking and design thinking are skills that more and more employers are looking for. I recently just saw that CDC was hiring design thinkers, which I thought was very cool. And just wanted to show some of the positions that our students are in that are directly aligned with this course. And so Emily Connor was my first teaching assistant in the first iteration of the class, and she is now explicitly a human-centered design coach at Healthy Teen Network. Macy Rush is a strategy designer for the City of Raleigh Municipal Government. Mundry is a postdoc fellow for innovation and human-centered design at VCU's Da Vinci Center. And Jackson uses human-centered design and design thinking in his work as the strategy and program analyst at the community safety unit within the city of Durham. And specifically, he works on Durham's HEART initiative, and there's a link to a video there for anyone's interested. So I would love to field questions or connect further if you have any, if you would like to discuss best practices for scoping and managing community partner expectations. I've spent a lot of time there of late. Or if you want to learn more about teaching design thinking or human-centered design in public health courses, especially rapid prototyping, so how we quickly test bits and pieces of interventions with community, let me know. And thank you for your time and attention, and we will transition back for Q&A.
Okay, well, thank you so much. So if all the presenters could go ahead and go back on camera, and we're going to go through some questions. Yeah, and I thought it was really interesting that the significant interdisciplinary nature and your course is pulling in folks from different fields. All right, so let's see. We got a couple. So, Nick, I'm going to ask the first question of you. The question is, given that harm reduction is a controversial topic, probably especially these days, how do you keep that to a minimum and not detracting from what you're trying to teach in this course?
Yeah, that's a good question. So one thing we did early in the course was talk about language and acceptable use of language and how to properly speak about these things, right? In the environment, we hear all types of things like someone is clean or dirty. Like, we don't use those words. We use a positive urine screen or a negative urine screen if they, test positive or negative for drugs. So just talking about ways to shift how we use language really helps develop that kind of more inclusive thing. Even if you see things in a different way from someone, you can talk about it in a respectful way. And I think we just, being in-person class with a lot of discussion, just helped everyone get to know each other and relate to where each other were from. So even when people had differing viewpoints, I think we were able to kind of meet in the middle and understand different perspectives. But I do think a lot of it really goes back to just that initial talk about what type of language is and isn't acceptable. And that helped keep things respectful, even if people disagreed and if it got a little heated at times.
Mm-hmm. Okay, great. Okay, so one of the purposes of this is to share your curriculum with other faculty, and one thing they always want to know is really what did it take to get your course started. So let's start with Liz, and then I'm going to go to Madison and Tammi, and then Nick, you can follow.
Great question. I think I had the idea for the class long before we offered it, and the pandemic also happened in the midst of the first offering. And our team, our original teaching team, it was me, a co-instructor, and Emily, our teaching assistant, really prioritized using the design thinking process to create the course. So I think that we spent almost a year in that design phase leading up to the class. So the resources that were dedicated to that was just time and then covering the cost of a TA to help with planning. And then year after year at this point, in terms of what things we pay for, in addition to a teaching assistant, we use Jean Litka's Innovators Mindset assessment at the beginning of the course, so students can figure out where their strengths are and where their gaps are, and then they self-reflect on that as they go through the entire course. So that takes up money. There's supplies in terms of just like prototyping. We do offer students kits that they can pick up with pipe cleaners and index cards and markers that they can take home so that they can do some of our warm-up activities on Zoom. And then we also often hire design thinking coaches to work with our students as they go through the semester long project. So we pay them $50 an hour to show up synchronously to our Zoom sessions, and then for them to provide written feedback on students' plans in advance of community engagement sessions. So I think that was the literal answer of like, what does it take to stand up the course? And then a lot of management of our community partners, which typically is owned by our teaching assistants. And so that is a lot of setting up the expectations in written form, making sure that people actually understood it. And because we asked them to invite people into our Zoom classroom or our in-person classroom, just making sure that the logistics translate to all those people. So happy to answer more questions, but I'll pause there and pass it on to Madison and Tammi.
Tammi, you want to take this one?
Sure. So with our dual credit students, we've been offering coursework online, on campus, and hybrid, where a teacher will actually go into the high school. And what we learned really quickly is high school students get very bored very quickly, and their attention span is you have a very short window. So lecturing at them was not the way to teach them about public health. And Maddie's role is a health educator specifically for high schoolers. So one of the things I feel like I've done a lot is Maddie's great, and we have another person that's responsible for college student programming, and really thinking outside the box and coming up with ways to engage the students in a very productive but yet fun and informative manner. So when we realized that the students, they were taking disease detectives at the time, and we really wanted to showcase what an epidemiologist does. What are the steps of an outbreak? If an outbreak happens, what are the steps that people that are working in public health, what role do they have? So we sat down and really started talking about options of activities that we could actually have the students be involved with that would allow us, that we wouldn't necessarily have to go into the classroom, but if we could bring them together in a setting and have them work together. As far as they were in groups, we broke them out into groups. So again, thinking about team-based learning, thinking about critical thinking, exposing them to careers in public health, exposing them to steps that you would need to follow, and tying that all together. How could we do that? So we started brainstorming, came up with this idea, and then had some discussion with the epidemiologist with the state, then met with med school and talked about how could we use medical moulage, or could we use it as part of this co-curricular experience. So it really was a creative approach that continues to, Maddie, what would you say? We continue to modify it a little bit and tweak it, so that it becomes more interactive and more engaging for the population that we're working with, given they're high school students. But we've also modified this for college students too. So we hope to continue to do this and make it richer and more of a fuller experience. This the presentation that we did on March 15th, we gave them some more tools to use as part of the outbreak investigation. So really walking them through everything that needs to be done, but not giving them the answers. So that part's been really interesting to see how they get to what is it an outbreak of, how did it start, those types of things. Maddie, do you have anything you want to add?
Okay, great, thanks, Tammy. All right, Nick, would you like to answer the same question?
Yeah, I was just going to say for the harm reduction course, I was brought in as a new faculty and asked to design a course for my first course. And my background is in tobacco research, specifically some of these less harmful alternatives like e-cigarettes and, snus and smokeless tobacco. And we have an addictions focused area as part of our MPH. But to me, harm reduction stood out as something novel but important. And I kind of looked around other curriculum at other public health schools and saw this was touched on here and there, but also was novel and innovative enough that it wasn't offered everywhere. And then I just kind of went and noticed that we see this everywhere, like in everywhere, but in Erie County, fentanyl is such a huge issue. And our county health department does a lot to combat these issues. And so I just kind of brought up how we see this every day. There's more and more jobs in this area as more funding is going towards it and grant programs. And these are things that our MPH students could reasonably potentially find work in or apply these skills to other things they do if they learn about this. But just kind of seeing how much work was being done in our community and how this is growing and becoming more formalized kind of opened the idea for it being a new topic for a course.
Great. I think what I'm going to do though, just do one more round of same question for all of you again. So if you had unlimited resources and all the support in the world, what would you do with this course in the future? And any of you can go first if you want to. Like, what's been holding you back?
I'd want every high school student to participate in an outbreak simulation.
If we want like some virtual reality elements to make it even more hands-on, we could get some VR glasses and really make it more interactive.
Now you're talking. All right. Liz, what about you?
Yeah, I think I'd extend my timeline. I think our community partners often feel really rushed in the semester-long structure with 16 weeks. So to do it justice and be able to see projects through to the end, I think we would either extend it so it's a 2-course experience or just have a second course that would require continued engagement. And then we would definitely pay people more for their time, whether it's our coaches or our community partners or the community members that they're bringing in to give feedback on ideas. And we would also stand up more like higher fidelity products in terms of the solutions and the interventions.
Right. Okay. Nick, any thoughts?
I think for me, if there were just more ways to get people firsthand, like field experience with this type of stuff, even though we integrated a lot of community partners, it was generally them coming talking to us about their experiences. But I think a lot of harm reduction, you learn by working with people who are actively using substances, who have tried to quit and have failed, and seeing the challenges they're going through and how they want to see their lives proceed. But I think sometimes it's hard to get that when it's mostly lecture and readings and talks from people who are doing it. So I think if they could get any of that firsthand experience, it would really push the course to another level.
Okay, well, that is great. So we will be posting this on our website. We get lots of people coming back. Want to hear all about your curricula. So thank you, everybody. And if anybody's on the webinar today is interested in submitting a nomination, we do open up the nominations in the early summer. So we'll have that announcement on our website. Thank you, presenters. It was great to hear from you. All right, thanks so much.
Thanks, Allison.